The Southern African nation has declared a public health emergency after hospitals ran out of essential medicine.
Botswana's president, Duma Boko, has just declared a national public health emergency. Hospitals are running out of life-saving medicines. The government has deployed the military. UNICEF is warning of malnutrition. But how can one of the world's richest diamond nations suddenly struggle to keep its people alive? Let's find that out. When President Duma Boko appeared on national television, the gravity in his voice told Botswana that this was not just another government briefing. It was a turning point. The work shall remain non-stop until the entire value chain of procurement has been fixed, he declared. For a country accustomed to decades of calm governance, the words carried an unfamiliar edge. Botswana was now in a state of public health emergency. The details laid out were startling. Essential medicines for cancer patients, antiretroviral drugs for HIV treatment, and tuberculosis supplies had all but vanished from hospital shelves. The health ministry confirmed debts exceeding 1 billion pula to private facilities. Elective surgeries, transplants, and non-urgent referrals were suspended indefinitely. In villages like Dakar, UNICEF teams reported rising cases of malnutrition, warning that the health of children was at serious risk. The government's response was immediate and militarized. 250 million pula was released from emergency reserves. Reports also say there's a 5 billion peso broader plan being assembled, with private and state entities contributing. Army trucks were loaded with supplies and dispatched from Gaborone to remote areas by nightfall, a striking image in a country where military convoys are more often associated with ceremonial parades than domestic crisis management. In the capital, Gaborone's Princess Marina Hospital echoed with the tension of short supplies. Patients waited hours for drugs that might not arrive. Nurses and doctors praised for their resilience, improvised treatment with whatever stock remained. Families were told to buy medicines privately if they could afford them, an impossible option for most in a country where unemployment is rising. But this emergency is not simply about logistics. It is not just a question of late deliveries or mismanaged warehouses. The shortages reveal something deeper. The fragility of a system that, until now, many assumed was stable. Botswana has long been hailed as one of Africa's most successful states, its economy underpinned by diamond revenues, and its governance often praised abroad. For decades, it was described as Africa's miracle. And yet here it was, suddenly struggling to provide the basics of health to its people. The contradiction was not lost on citizens watching Boko's address. How could a nation globally celebrated as wealthy and stable find itself unable to secure medicines that its people desperately need? The president has already staked his reputation on diversifying Botswana's economy. Now, this health crisis threatens to define his leadership. Unlike his predecessors, who governed in times of relative diamond prosperity, Boko faces the hard edge of dependency and the political cost of being unprepared when external forces turned against Botswana. Still, the speech carried resolve. By putting the military in charge of distribution, Boko signaled that this was not business as usual. His promise to fix the entire value chain of procurement was not simply about plugging gaps. It was about rebuilding a system from the ground up. The question, however, remains: why does such a wealthy, diamond-rich country need an emergency declaration in the first place? Why would Botswana, the world's leading diamond producer, reach a point where cancer patients, HIV survivors, and tuberculosis sufferers are left without medicine? The contradiction is sharp, and it leads us to the uncomfortable truth about Botswana's economy. The answer is not hidden in hospitals or warehouses. It lies in the glittering stones that built Botswana's image abroad. Diamonds, for all their brilliance, hold the key to understanding why this crisis erupted, and that is exactly where we must turn next. Botswana produces roughly 1/5 of the world's diamonds by value, making it one of the most diamond-rich nations on Earth. For decades, this resource has been celebrated as the backbone of the country's stability, the jewel in its economic crown. But there is a catch. The diamonds themselves don't stay in Botswana. From the moment they are extracted, the stones enter a global chain dominated by international companies and foreign markets. At the center of this system stands De Beers, the historic giant that, until recently, held near total control over the sale of Botswana's diamonds. Even today, despite Botswana's efforts to renegotiate terms, the reality remains the same. Most diamonds leave the country in rough form, and most of the value is captured elsewhere. By the time the gems glitter in New York, London, or Paris, their price has multiplied many times over, but those gains rarely flow back to Gaborone. This is the paradox. Botswana is rich, but only on paper. The numbers look impressive in GDP reports, but the liquidity available for public health budgets is far more limited. And when the international market slows, as it has in recent years, with declining demand in both the US and China, Botswana's revenues plunge. The dependency on diamonds becomes a curse rather than a blessing. Consider this. Botswana's government still relies on diamonds for around 2/3 of its export earnings, and more than 1/3 of its national budget. That means when the diamond trade sneezes, every other sector catches a cold. Jobs vanish, imports grow expensive, and, crucially, health budgets shrink. Unlike countries with diversified industries, Botswana has tied its fortunes to a single commodity that it does not fully control. The vulnerability becomes even clearer when we follow the supply chain. Diamond cutting, polishing, and retailing, the stages where most profits are made, overwhelmingly take place abroad. In effect, Botswana exports raw wealth and then imports finished products at higher prices. It is the same colonial model Africans have endured for centuries. Raw materials leave, finished goods return. Diamonds may glitter in Western storefronts, but they do not buy medicine in Botswana's clinics. This structural weakness explains why the health system unraveled so quickly. Botswana's diamond earnings, already squeezed by global downturns, could not stretch far enough to cover growing medical needs. And the moment external shocks hit, from market slumps to rising unemployment, the system buckled. What looked like prosperity from a distance revealed itself as fragility up close. But this raises another question. If diamonds have long created vulnerability, why hasn't Botswana fixed this problem before? Why did the health system rely so heavily on volatile revenues rather than building internal resilience? The answer lies in a second, equally important piece of the puzzle, one that reveals how Botswana's crisis is not only economic, but political. For decades, foreign aid has played a central role in Botswana's health system, particularly in its HIV response. That aid seemed like a lifeline until it was suddenly cut, and when it disappeared, Botswana discovered just how dangerous dependency can be. Let's pause for a second to say, big thank you to the Black Culture Diary community, where Black voices, stories, and legacies are preserved and amplified. By becoming a member, you're not just supporting the channel, you're becoming part of a powerful cultural movement. Let's continue. If diamonds made Botswana vulnerable, aid dependency made it fragile. For decades, much of the country's health system, especially its fight against HIV, leaned heavily on foreign assistance. By 2020, UNAIDS estimated that nearly 1/3 of Botswana's HIV response was funded by the United States alone. In a country where almost 1 in 5 adults lives with HIV, those funds were not supplementary, they were lifelines. On the surface, this partnership was praised as a model of international cooperation. Western governments boasted of their generosity, pointing to Botswana as proof that aid could change lives. But beneath the rhetoric lay an uncomfortable truth. Aid is never free. It creates reliance, shapes systems, and locks nations into structures they do not control. In Botswana's case, the health sector became dependent on decisions made in Washington, not in Gaborone. That fragility was brutally exposed when US President Donald Trump slashed aid budgets. Almost overnight, Botswana lost a critical share of its HIV funding. The decision was framed as fiscal discipline, a domestic debate in America about where to spend taxpayer money. Yet for Botswana, it was a reminder that its health security was tethered to political whims abroad. Thousands of lives could be put at risk not because of anything Botswana did or failed to do, but because of shifting priorities in a distant capital. And this is the deeper danger of aid dependency. It transfers sovereignty. When a government cannot plan its own health budget without waiting to see what donors will provide, it is not fully in control. Hospitals may look stocked, clinics may appear functional, but behind the scenes, stability hangs on foreign decisions. The impact of the cuts went beyond HIV. With less donor money, Botswana's health ministry had to redirect domestic resources toward HIV care, leaving fewer funds for cancer treatment, tuberculosis programs, and surgical services. In short, one foreign decision created ripple effects across the entire system. By the time President Boko declared a national emergency, shortages were not limited to one area. They spanned the spectrum of care. What makes this particularly striking is how aid dependency masked underlying weaknesses. For years, Botswana appeared to have one of Africa's stronger health systems. International observers pointed to falling HIV infection rates and increasing life expectancy as signs of progress. But in reality, much of that progress was built on donor scaffolding. Once the scaffolding was removed, the cracks became visible. This raises an uncomfortable but unavoidable question. What does it mean for a sovereign state to outsource the survival of its citizens? Botswana's crisis is not simply the result of mismanagement or bad luck. It is the logical outcome of a system where external aid replaced internal capacity. Yet here, too, lies opportunity. The shock of aid withdrawal has forced Botswana to confront what it long avoided: the need to fund and manage its own health system on its own terms. President Duma Boko's emergency declaration and his choice to mobilize domestic resources rather than run to donors reflect this shift. It signals an attempt to reclaim sovereignty, even under the weight of crisis. But can one leader turn dependency into resilience? Can a country so long accustomed to aid now rebuild with its own means? Those questions lead us directly to the role of Duma Boko himself, a man whose rise to power broke political traditions and who now faces the greatest test of his leadership. Here's a reminder to please like and share the video and subscribe to our channel to watch more videos on Black culture, history, civilization, and identity. Let's continue now. When Duma Boko swept into power in late 2024, it was more than just an election upset. His victory ended 58 years of uninterrupted rule by the Botswana Democratic Party, a party so entrenched in power that many thought it inseparable from the state itself. Boko, a Harvard-trained lawyer with Pan-African leanings, had campaigned on a bold promise to diversify the economy, break the country's over-reliance on diamonds, and chart a new course for sovereignty. His words captured the imagination of young voters, many of whom had grown weary of a political order that seemed stable but stagnant. Now, less than a year later, Boko finds himself in the crucible of leadership. The public health emergency has tested his promises faster than even his supporters anticipated. But rather than follow the well-worn script of appealing to foreign donors, Boko has chosen a different path. His emergency plan relied on domestic funds, 250 million pula redirected toward health procurement, and the deployment of the Botswana Defense Force to manage supply distribution. This was more than a practical decision. It was a symbolic one. By bypassing international aid and placing the crisis firmly under state control, Boko sent a message. Botswana will confront its problems with its own hands, not by stretching them outward. For a continent long pressured to depend on Western aid packages and IMF loans, this stance is quietly revolutionary. But the gamble comes with enormous risks. Botswana's financial reserves are not limitless. The economy remains vulnerable to external shocks, and Boko's political capital, though strong, is not infinite. If the emergency measures fail to restore stability, critics will accuse him of recklessness. Yet, if he succeeds, he will have established a model for how African states can respond to crises without reverting to dependency. What makes Boko's approach distinctive is his focus on systems, not patches. In his address, he did not simply promise to deliver drugs to hospitals. He spoke about repairing the entire value chain of procurement. That phrase is technocratic on the surface, but its meaning is radical. Boko is not content with short-term fixes. He is aiming to reconstruct how Botswana secures, transports, and distributes vital supplies so that such shortages never repeat. In practice, this means reducing reliance on imported pharmaceuticals, tightening oversight of middlemen in procurement contracts, and ensuring state capacity matches the demands of its citizens. If pursued seriously, such reforms would not only secure health supplies but also lay the groundwork for Botswana to become a producer rather than just a consumer. Imagine diamonds funding not just exports but domestic pharmaceutical factories, an economy where Botswana's natural wealth directly fuels its people's survival. Of course, no leader operates in isolation. Boko's choices will be measured not just in local hospitals but on the continental stage. Other African leaders are watching closely. The question is whether Botswana's stance can inspire a broader shift, one in which African states, confronted by crisis, lean inward rather than outward, trusting their own resources over foreign lifelines. For now, Boko is walking a tightrope. He has to prove that sovereignty is not just a slogan but a viable governance strategy. The emergency will define his legacy. He will either be remembered as the man who dared to build Botswana's independence during its darkest hour, or as a leader who overreached in the face of crisis. Yet his gamble fits into a much larger story, because what is unfolding in Botswana is not unique. It is part of a wider African pattern, nations breaking away from dependency, reclaiming control of their resources, and resisting Western dominance. To see Boko's gamble in full perspective, we must zoom out from Gaborone and look at the continental picture. And that is where the story now turns. Duma Boko's gamble does not exist in a vacuum. The choices unfolding in Gaborone are part of a much larger continental story, one where Africa is confronting the limits of dependency and charting a path towards sovereignty. To understand why Botswana's emergency declaration matters beyond its borders, we must see it as one chapter in Africa's wider struggle against the global order that has long drained its wealth. Across the continent, similar scenes are playing out. In Niger, the military government shocked Paris by seizing control of uranium mines that had for decades powered French nuclear plants while leaving Niger itself in darkness. In Burkina Faso, Ibrahim Traoré's government unveiled its first state-owned gold refinery, capable of processing 400 kilograms a day, declaring that the days of exporting raw gold while importing poverty were over. In Angola, oil contracts are being renegotiated to tilt power back toward Luanda rather than foreign corporations. Each of these moves signals the same determination. Africa will not remain a supplier of raw materials while its people struggle for survival. Botswana's health crisis fits directly into this pattern. The shortages of medicine are not random failures. They are symptoms of the same structure, a global economic order where Africa exports what it has in abundance and imports what it should be able to produce. Whether it is diamonds, uranium, gold, cocoa, or oil, the logic remains unchanged. Extract, export, and depend. What Boko's emergency declaration does is expose this logic in real time. It makes clear that a nation can be rich in resources yet poor in sovereignty if it does not control the value chain. And this is why Boko's decision to rely on domestic funds and the military, rather than donors and lenders, carries continental weight. It signals that Botswana is not simply responding to a health emergency. It is asserting that the solution lies within, not abroad. In a continent long accustomed to aid missions swooping in with promises of salvation, this reversal is profound. It reframes Botswana not as a victim of shortage, but as a participant in Africa's wider rebellion against dependency. Of course, the challenges are immense. Botswana will need to develop pharmaceutical capacity, rebuild public health procurement systems, and diversify its economy away from diamonds. But that is precisely why this crisis may become a turning point. History shows that sovereignty rarely emerges from comfort. It emerges from necessity. Just as Niger's uranium nationalization was born from sanctions pressure, and Burkina Faso's gold refinery from the need to secure revenue, Botswana's health crisis could force the country to reimagine its future, one in which diamonds fund factories, not foreign shareholders. The significance extends beyond economics. It is about dignity. It is about whether Africans will continue to live under systems where a downturn in Antwerp or a budget cut in Washington decides whether their hospitals have medicines. It is about whether the wealth under African soil finally translates into security for African people. In this sense, Botswana's emergency declaration is not an admission of failure. It is a declaration of awakening. As the convoys of military trucks rolled out of Gaborone that night, carrying medicines to remote villages, they carried more than supplies. They carried symbolism that Botswana, like so many African nations today, is choosing to act rather than plead. And if this moment sparks a larger continental shift, historians may one day look back at 2025 as the year when Botswana's crisis became Africa's rallying cry. Because the question is no longer whether Africa is rich, it always has been. The real question is whether that wealth will finally be used to build sovereignty, resilience, and prosperity at home. Botswana has just answered with a resounding yes. Should Africa keep relying on foreign aid when it controls the world's most valuable resources? Let us know in the comment section. Do you believe Botswana's crisis is a tragedy or the beginning of Africa's awakening? Do you want to watch more videos like this one? If so, subscribe to our channel and press the bell icon next to it. We have decided to bring videos on something nobody talks about: the Black culture, civilization, history, and evidence about how glorious Blacks have been. Thanks for watching, and until the next video, stay tuned.